name is Jessica Thomas, and tonight we're going to be talking about seasonal depression. And we're going to talk a little bit about it from an educational perspective to learn a little bit more about it, but we're also going to talk about it in a proactive way so we can kind of fall forward into healthy emotional habits. And I'd like to thank our sponsor for this program, Bristol Myers Squibb. We are very thankful for their sponsorship. Without their sponsorship, the MS Mental Wellness Chat would not be able to be here, as well as MS Views and News. MS Views and News is the reason why the MS Mental Wellness Chat is here in front of you and bringing people together. So thank you to both, but thank you to Bristol Myers Squibb for their support tonight. So I'm going to start off with an introduction about myself, and this is in the case that you have not met me or you're new to the Mental Wellness Chat. So these numbers here, I feel like tell my MS story and my professional story pretty well. 18 is the number of years that I've been married. 17 is the number of years that I've been living with MS. So I was a newlywed when I was diagnosed. I also was a social worker this whole time. Even at 18 years, I was a social worker. And then 16 is the number of years that I've been working as a clinical social worker specializing in helping people live with chronic disease. So I've worked in a lot of different capacities. Of late, I am a patient education director, but I've been a therapist and a counselor. I've worked in nonprofits, et cetera. And my whole reason for work has been to help people find ways to live well with their disease. And then 15 is the number of years that my son turned this year. So I always like to include it because it just kind of shares, I've had a son after my MS diagnosis. And then also he's getting older. So I might have some feedback and insight as I, chime in about like a personal experience. This will be a professional presentation, but I have experiences too since I have MS. And so I have a teenager and that's not always easy. So today we're going to talk about seasonal depression, and the reason why I picked this topic, and I picked it in September, is because I know that before we can even think about it, it's going to get colder. It's going to be the daylight hours are shorter, and so we tend. As a therapist, I tend to see a lot more depression during the late fall and winter months. So I thought if we covered this topic a little bit earlier, that it would be helpful. And then I think when you blend in some of the fall and winter holidays as well, you think about Christmas and Thanksgiving, that sometimes while those are beautiful holidays and they can feel really good, sometimes they actually exacerbate a little bit of those feelings of loneliness too. So seasonal depression is a clinical diagnosis. It's a seasonal affective disorder, and it's a type of depression. It's usually triggered by when the seasons change. Most commonly, it begins in the late fall. But I do want to note that that this also can happen in a different way as well. Like, so in the summer, you can experience seasonal depression too. And it's hard because summer can be hard for some people with MS if you're heat sensitive. So what we know about seasonal depression is that, often there can be a feeling of sadness or a depressed mood, loss or losses of interest or activities that you used to enjoy. Maybe you're not enjoying them quite as much. Increased fatigue, having feelings of guilt or worthlessness, having a hard time concentrating, and some people can have suicidal ideation, so it can be a very severe diagnosis as well. So for some people, it is triggered by just the change in seasons, the less ability to have light, etc. And if you've had any of these symptoms, or you go into the fall or winter and you've experienced these symptoms for more than 2 weeks, I'm going to encourage you to, one, if you experience suicidal ideation, I want you to go ahead and automatically contact your doctor. But if you are experiencing, I'm so sorry if you can hear that little buzz. If you are experiencing these symptoms, what I want you to do if you're more than 2 weeks is to reach out to your doctor. So we have Patty here, and Patty is from Oregon. It is so good to see you, Patty. So I'm going to continue to look at that question box. So we're going to talk a little bit more in depth about the symptoms, just a little bit more. So it is very much like depression, very, very much like depression. And so with that, you can you see the lowness in your mood. You can also have feelings of hopelessness and guilt, etc. Having loss of interest, lower energy, and we're going to talk about in a minute how some of the symptoms of seasonal affective disorder actually are very similar to some of the symptoms of MS, so we can identify the differences between both of those. Another symptom I wanted to mention is kind of feeling listless or down for most of the day, nearly every day, and just kind of, or having apathy, having a hard time kind of moving through your day. So how this is different than regular depression is that this would be something that is kind of triggered during a season, a couple of months, and you might experience it consistently year to year, if that makes sense. I know when I worked as a therapist, I would often see that. I would see the patients, and it was really neat to see people for multiple years, because you would know that fall was coming up and that this was going to change. And I had one person that I worked with that we automatically knew to put in all the proactive measures because we knew that fall was coming, and that was a really triggered month for her in her depression. So we'll move on to our next slide. So I am going to ask you as a group, and this is kind of a vulnerable question, and I like to ask vulnerable questions. Now, if you don't want me to say your name, just say, don't say my name, and I won't say what your name, but I might read what you say, if that's okay. If you don't want me to say what you're saying, then just say, don't say it at all, and I won't read it out loud. But I wanted to ask, do you experience mood changes with seasonal changes? Have you ever experienced that? And I will get us started. Because it usually takes a little bit of time for the answers to come in. But we had a winter a couple of years ago. I'm in North Carolina, and so we are very lucky to have very blue skies, a lot of sunshine, very different than the East. Eastern or Northeast, like Boston, that might be a little bit more cloudy or gray during the day in the winter. But we usually have Carolina blue skies, and we went through a January that was very dreary, and the skies were gray. It was rainy, and I realized after a couple of days, because it lasted for a couple of weeks, almost the whole month of January, that my mood was really impacted by the lack of sunshine and the lack of the ability to go outside, etc. And so I'm going to read some of your comments now. We have Kanita that says that guilt without feeling down and listless seems more like anxiety than depression. Is that sad or something else, a seasonal depression or not? If you have plenty of energy and you're feeling guilty, feeling guilt without feeling down or listless, it may be something that I would encourage you to talk with someone about, because you might be able to identify where that feeling of guilt is coming from. So I wouldn't say necessarily seasonal affective disorder, but I would say talk to someone, kind of tease it out, because you might be able to figure out what's going on. Patty says, yes, she definitely has some seasonal changes. Linda said, yes, but during the hot summer months. So I do know with MS, I think we're a special population. If you are some people during summer months can experience emotional changes, but then also because MS is so sensitive to the summer as well, the fatigue, etc., and symptoms, that sometimes mood can change easier in the hotter months. So Julie says, no, that is great. Boylan says, yes, and yes. Connie says, yes, during the time change when it gets darker earlier. Cheryl says, no, Southern California doesn't lend itself to climate change that affects mood. That seems to be bigger than MS. Yeah, seasonal affective disorder is definitely not specific to MS at all. It's actually very specific to the general population, but because people with MS are more susceptible to depression, is the reason why we're talking about that seasonal affective disorder today too, is because people that tend to have a dysphoric effect or a lower mood can feel a little bit more lower sometimes. But I love that Southern California does not have, you guys have great weather, so that probably makes a pretty big difference. 4 symptoms that seasonal affective disorder and MS have in common. So this was the article I wanted to share. It's by Matt Cavallo, and I believe it was published in I want to say maybe in the Momentum magazine, but I thought it was a really good article. And so these are some of the things to kind of know. You heard me talking about symptoms, and I talked about fatigue. So fatigue is one of the top symptoms in seasonal affective disorder that I was mentioning, but then also it is very, very, very common with MS. So I'm going to ask you right here, how many of you deal with fatigue with your MS? And while we're answering, while you're answering, we're going to have read a couple more. So Rhonda says in the fall and winter she tries to plan and wear a list of things that she can do. Good, Rhonda, we're going to talk about this, how to be proactive. That's going to fall into that. That is great. And then Norris says that she experiences depression and really loves the summer. So she has some seasonal changes, and Ohio is cloudy often. Boylan here is dealing with the loss of his wife, and thank you for sharing, Boylan. I'm sorry to hear. And so sometimes during a seasonal change or even an anniversary change of a loss can create some sadness. Nora says yes. Linda says constantly. We're talking about fatigue now. Heidi said yes. Maddie said fatigue, yes. Boylan, yes, very much. Bruce, fatigue all the time. And Maddie says black coffee helps. Coffee helps me sometimes, not always. Connie said, and that's her main symptom with MS. Kanita said not really, and that is great. Fatigue does not hit everybody with MS, and that's a good thing. Stacy said, I have fatigue issues. Julie said, I do when the heat is bad. So you can kind of see that fatigue, just from that question, fatigue is very common in the population with MS, and it's common with seasonal affective disorder too. So I just want to kind of say that's important to mention, because you might have fatigue because you have MS, and so might not necessarily be because of seasonal affective disorder. And then Rhonda says yes, too. So the next symptom that is similar to that's common in seasonal affective disorder and MS is sleep disorders. Now I'm going to ask you in the question box, how many of you have trouble with sleep, have trouble falling asleep or staying asleep? Okay, so Linda says, I fall asleep but wake up after a few hours. That happens to me sometimes. I'm a pretty good sleeper, but that can happen to me. Belinda says, not at all. That is great. To be a good sleeper is a great thing. Helen says, trying to stay asleep. Cheryl said, yes, worse as I age and move into secondary progressive. I do think sleep, from what I know as a therapist, is sleep tends to get a little bit worse as we're getting older. Nancy says yes, quite often. Nora says lots of trouble sleeping and falling asleep. And that adds to cognitive in the morning, and cognitive and fatigue in the morning. Absolutely. Julie says sleep is good. Maddie says nightmares sometimes. That will absolutely hurt sleep. Patty says somewhat. So you can kind of see that, from a general poll of the people on the MS mental wellness chat, that sleep challenges exist. They're not congruent with everybody, but they are. It's pretty mixed here. And then we have someone who Cheryl takes melatonin, so she doesn't have a problem. So you can kind of see that with seasonal affective disorder, that there are sleep changes, but then also with MS, there's sleep challenges too. And so I just want to note that. Now, how about this? Problems concentrating. How many of you on here have trouble concentrating sometimes? And I will get us started. Fatigue is my very biggest symptom with MS, and the probably the secondary is cognitive fatigue. So that can challenge a lot of things, but concentrating can be one of them. Boylan says all the time. So if you have trouble concentrating, let us know. And the reason why I'm asking is to kind of connect each other so we know that we're not alone. And then also so we can kind of just see that, who is impacted. Patty says it's getting harder. Helen says, yes, it can get to me. Kenita said, definitely a squirrel. So she has shorter attention span. Linda said, only when fatigued. Connie said, yes, my second symptom. Carol says, yes. Bruce says, cognitive slowness and concentration. So we can see that cognitive challenges are, they're not a guarantee with MS, but they do happen quite a bit. When, mood changes are very common with MS. We have talked about mood changes here in the past at the on the MS mental wellness chat, and mood changes can come on for a variety of reasons. It is common with MS, and it is common with seasonal affective disorder. Do you ever feel that you have any variations in your moods? And we have Stacy that has no problems concentrating, which is great. I love that when we have people on here that don't experience the symptoms too, because that provides balance for us. So Carol says, in regards to mood, it depends on stress level and sleep. And I would say that's the same with me too. My mood changes are very related to stress, sleep, and food, energy. Helen, yes, moods can come and go often. So we don't have as many, but you can continue to chime in here as you can. So I've talked about the symptom. Boylan said yes. Kenita said with stress. And so you can see that, we do, and that one I think can feel like a little bit hard to talk about sometimes. But if you notice that you have mood changes, that might be something that is, with your MS, and it might be related to stressors or sleep or et cetera, or changes in your life. And so, and there is a MS mental wellness chat that we did specifically on moods too. Patty can cry easily. Stephanie says with stress. Nora said used to be a lot more severe, but it's evened out. Although all can go out the window with stress. Yeah. You can see how stress can really impact moods. So I gave you these 4 symptoms, and the reason why I did, we can move on to the next slide. It's to say that that there's some correlation, and so your MS just has maybe some things that are in common with seasonal affective disorder. So as I do this presentation, I think it's important to know that just because we're talking about certain symptoms that you might experience, that might not mean that you have seasonal affective disorder. This would be something I would want you to talk with your doctor about. But one of the biggest differences is that seasonal affective disorder occurs mostly the same time of year. So if you notice that the onset happens in like October, so with seasonal depression, it occurs mostly the same time every year. And so it is a seasonal thing. It's something that you're going to notice that is consistent. Now, let me ask you, have you ever seen a doctor about mood changes before? So we'll move on to the next slide. I'm just interested to see, as a group, have you ever talked to a doctor about mood changes? And I will get us started because I like to be authentic. I have, through the course of my, my 17 years, definitely have talked to my doctor about mood changes when I experience them. So we have Linda says yes, Boylan says no, Carol says no, Michelle said the holidays are difficult for me. I don't look forward to the holidays. Nancy says no, Rhonda says no, Patty says no, Stephanie said yes. Kenita said now planning to make an appointment. Nora said yes, but not around seasonal mood changes. And I'll go back and say mine have not been around seasonal mood changes, but just in general, have you seen or talked to your doctor about mood changes or concerns? Stacy, no. Julie says, I'm moving. Thank you. Now I'm really worried that you guys are going to have bad video quality, and I'm sorry with all my heart, but I'll do my best for this. Julie said no. Maddie said yes, with the neurologist and also the counselor. So the recommendation from here is that, and we'll go on to our next slide, is, when do you see a doctor, about this? If your mood is down, or if you're dealing with some specific things related to depression, or if you're noticing that you might be experiencing some changes in your mood just because of the season, or just in general because of MS and life. And depression is very high with MS as well as anxiety. And so when do you see a doctor? Well, I want you to know that some days you're that are just going to be sad, right, or hard, or some days you might have anxiety, and and you should be able to move yourself through that day, even if it's a hard day, even if you sleep more that day, or you have to be compassionate with yourself. But if you're having multiple days in a row, really, 2 weeks is really, I think, a good guideline, and you're just really not enjoying things that you normally do, it's really important to see your healthcare provider. If you notice that there's changes, so if you normally are a great sleeper, and all of a sudden you can't stay asleep and you're waking up every night, this may be a good reason to see your primary care or your MS specialist about. Just to talk with them about it a little bit, the changes that you're experiencing. They may be related to stress, they may be related to other things, but it's important to note that if you're going several weeks and you're seeing changes in your mood and how you're feeling, because what will happen is that changes your quality of life, right? Because how you're feeling and your mood is sort of the lens of how you look at things as you go through your day. And so if you are noticing that anything has changed in your patterns, how you're eating, how you're sleeping, how you're feeling in general, then it's probably time to talk to your doctor, especially if it's been longer than 2 weeks. And I want to continue to reiterate how important it is to talk with your doctor about these things, because while there's not a cure for MS, there's treatments and such. Depression, seasonal depression, anxiety, other mood disorders and changes and challenges, there's treatment for that. And it's not necessarily all medication, but there's resources and treatment. And I just want that to be known. So we have Boylan, who sees a therapist every week, which is great. Stephanie has had family stress, and I'm guessing that some of the correlation, and that's a good reason to see a doctor, or when you're seeing your doctor, to talk about or to consider seeing a counselor, because there can be a lot of family stress, and that can impact how you're feeling physically too. We have Michelle's talked with her neurologist, but has not seen or talked with a therapist. And I'm Bruce. I'm going to talk a little bit here about the seasonal affective disorder light. That will be helpful too. So we're going to move on to our next slide. We're going to talk a little bit about prevention. So I want you to think about this like seasonal affective disorder prevention, but also think about this as just general mood prevention too. That this is all stuff that you can put into place. The light is going to be very special, but other than that, the things are going to be very similar. And so some preventative things that you can do for seasonal affective disorder, but even with depression, they are things that you can do. Spend time outside every day, even if it's cloudy. The effects of daylight will help you some, and that's important to know. If it's too cold outside, open your blinds and sit by a sunny window. In the room that I did therapy in, and that I normally would do this presentation in, it's a sunroom, and I would open all the windows during the winter, because that's really important to help with mood. Also, getting a seasonal affective disorder light might be helpful. So, talk with your doctor, but the advice is to begin using a 10,000 LUX light box when fall starts. before you even feel the effects of winter or seasonal affective disorder. And I have had clients that have had to use these through the years. They've been very effective. During COVID, I got one relatively cheap on Amazon. That was the 10,000 LUX, and it's a great resource. I was lucky. I have a really sunny room, but I wanted to see how accessible they were to get and what they looked like, etc. And when we had some really down days and a lot going on during COVID, I put it on and used it some. Also, another proactive preventative thing you can do is eat a well-balanced diet. This will help you have more energy. Even if you're, craving starchy or sweet foods, you do see that with seasonal depression sometimes, that you might want more carbohydrate-based food and you deviate from that healthy. But if you're staying with your healthy eating patterns, this is going to have you have more energy, and it is also going to help you feel a little bit more full instead of wanting to eat the other foods that you might be craving. And then exercise for 30 minutes a day, 5 days a week. Now, let's talk about exercise because I think it looks for MS. It can be modified exercise. Exercise looks different for all of us. And so 30 minutes a day could be 3 10-minute walks. It could be doing something like housework for 30 minutes, something you enjoy for 30 minutes that is moving your body. And so I know that, we are all very different in our ability and skill level. Some of you may be far more advanced and able to do much more than I can, and vice versa, so finding what you can do. But exercising is really helpful because what it does is it will create chemicals in your brain that will help you to feel better. So exercising for 30 minutes is actually going to carry you over so much more from a mood perspective for even hours longer, usually because of the endorphins that you produce. So that is why we kind of hone in on exercise for mood. And then I wanted to mention for prevention too, sometimes medication is needed. And so I just wanted to mention that, not for many people, but I have had patients in the past that when the seasonal depression starts, they contact their doctor and they make tweaks to their medication. And then when things get a little bit better, they tweak it back and they work really closely with their doctor. So I just wanted to normalize that some people take medication too. Kanita here shared that I like to sit and be fit. So I love that. I like sit and be fit. So that sounds like it's an exercise program, Kanita. If it is, just write back yes, and I will make sure I let the group know. But sit and be fit. So if you need to have some modifications, that sounds like it is a great resource as well. So we're going to move on to our next slide. Oh, and Kanita said yes, so sit and be fit. That is a exercise program. Do you have any prevention strategies? And if so, not just yes or no, but if you have any prevention strategies, things that you put in place, what do you do to kind of take care of yourself? And we'll talk a little bit about interventions next, but I wanted to see on a preventative level. So it looks like Kanita twice a week does the sit and be fit, which is great. Prevention strategies that I use is I try to maintain some level of activity outside if I can, because in the fall I feel a little bit better because my energy is better. So Maddie said for prevention strategies, he's avoiding things, he says big groups, but triggers, things that trigger some of his feelings. And then Helen says walking outside and resting well. That is really good and preventative. Kanita says watching stand-up comedy on YouTube. I love that. We have had some of our usuals or regular people are not on here tonight, but I would know that one or two of them would say music. Rhonda says a daily routine. That you've got it. We're going to talk about that in a second here too. Having a daily routine can be really helpful to move through every day with depression or anxiety, mood changes, but especially with seasonal affective disorder. And then Carol says aquafit, but no availability this fall, so exercise, visit a friend. Stacy says that she opens her curtains and does meditation. That is a great great preventative strategy as well. So we're going to move on to our next slide. And we're going to talk a little bit about interventions for seasonal depression. So we have counseling. That can be an intervention. I know for some of the patients that I used to work with, they would schedule, we'd schedule a little bit more frequently when it was the fall and the winter, because we just knew that their moods were a little bit lower and they needed extra support. Medications may be an intervention. Behavioral activation, so that's the exercise that we're talking about. There is TMS, the transcranial magnetic stimulation. I don't have a lot of information on that, nor do I want to spend a lot of time on it because of that. But TMS is not really a procedure. It's more of I'm trying to think where you go in and you have it done, but it's not a procedure-based thing. That they're kind of like light therapy, sort of, but it's not quite. But that has been helpful for interventions for seasonal depression, especially if medication is not effective and you've tried behavioral activation, tried other things. And then the vagus nerve stimulation. For the vagus nerve stimulation, that is finding a way to calm your body. And so we have, Kanita says, is medication for a seasonal affective disorder different than regular depression? Yes and no. No, the medication generally is not different, but it may be used differently. So it may be used for a shorter period of time. It may be used only during the months that you're affected by seasonal affective disorder. And so very similar to what I think with premenstrual dysphoric disorder that some women have, that when they are in that PMS period, sometimes they have medication changes during that period, and so during like a 1 week window that they have a higher dose of medication and then they're back on their regular dose. But it's something definitely to talk to your doctor about. So we're going to move on to our next slide. And we're going to talk a little bit about neurotransmitters and mood. I'm not going to stay here super long, but here's the deal, is that there's things that we can do to improve our mood. And these are things that we can do through exercise. Like, for example, when we exercise, it increases endorphins, which provides pain relief and feelings of elation. If we go sit out in the sun, serotonin improves willpower and motivation and mood. Oxytocin, if you were to if you have any animals, if you were to pet them or give someone a hug or hold a baby, that creates oxytocin, and that promotes feelings of trust, love, connection, and reduces anxiety. And melatonin enhances the quality of sleep. So there's a lot of things that we naturally can do that will improve our mood, and it's important to know that there's things that you can do. There is a really good book, and I've mentioned it before in the past, and it's called, I believe it is called Spiraling Up from Depression, One Small Step at a Time. I believe that's what it's called. And in that book, it talks about the neurotransmitters and mood and their role in it as well. But there's proactive things that you can do to help with mood changes. So I want to call attention to how you start your day matters. So thinking about healthy habits, thinking about a routine. Because literally how you start your day kind of sets the tone for your day. And so if you know you're more vulnerable with fatigue, etc., it might be having a routine that you move through, or it might be doing meditation, or it might be inviting things into your life in that morning to help you kind of set your day in a good way. It might be opening the blinds. Getting as much sunlight as you can in the house, but thinking about how you start your day, how you end your day matters. So I want you to think about, what is your routine? What are things that you do in the evening as you're winding down? Thinking about some healthy habits, things that you do. I know one of the things that I do pretty frequently is practicing gratitude, and that has been a really good evening activity to do. And Boylan says making his bed every day is one of the habits that he does in the morning, and that is a really good strategy. I almost brought a book with me, but I didn't want to weigh my luggage down with books. But I almost brought a book, and it was, I feel like there was something about making your bed is the title, and it is really just some strategies that you can have that kind of set your day in a good way, and making your bed is one of them. It's a really great thing. So think about how you end your day, because that matters too. Can you put in strategies or put in examples or things that you can do that allow you to end your day on a peaceful, nice note? So this is another thing when I'm working with patients with either seasonal affective disorder or really just depression, mood changes, or just a hard time. I think one of the things that we can do is to have things to look forward to. And I mean little tiny things and then maybe big things. So for little tiny things, it might be a cup of tea in the afternoon, or a phone call with a friend, or it might be watching a show in the morning or evening, or going to check the mail. I don't know what, it's so individual for all of us, but actually, if you can, in the question box, put down, what is something that you look forward to? A little thing that you look forward to every day. And I will read those as they come in. But it's important to have little things to look forward to and big things. And when I think about big things, it might be big things might be a lunch with a friend, or going to California is a big thing for work. But that's not a normal thing, so I don't like to hone in on those. Antoinette says my morning walks and coming home to breakfast and coffee. I always look forward to coffee, good coffee. And Nancy says, start my day with a strong coffee. So we have a lot of coffee lovers here. Helen says a tea at 3 o'clock every day. That is perfect. So having little things that you can do. Also taking a bath. I take a bath sometimes in the evening, and that's something I really look forward to in the evenings. And so thinking about, as you structure your day, how do you structure your day in the morning to have, and because it matters, how do you structure your evening, and then how do you make sure that you have things to look forward to, and then when you do them, to give yourself a little bit of a reminder that it is really important to have things to look forward to. So here, this is kind of I've had this in different programs that I've done, but I always think it's the slide of value. I know it just looks like a spiral up, but it's the idea that if we, so we're going to use Boylan's example about making his bed. So in the morning when he wakes up, when he makes his bed, what he has done from that is that he creates a little spiral. So he like moves up a little bit, because that feels really good and accomplished to make your bed. It really does. And so from there, he might be able to make another little choice or little decision that helps to kind of spiral up a little bit. It doesn't mean that he's going to get, way high if his mood is lower, or et cetera. But it means that it gives you the opportunity to move up a little bit and to feel a little bit better. And okay, so the book, I found the title of the book. Book is called The Upward Spiral: Using Neuroscience to Reverse the Course of Depression, One Small Change at a Time. It is a fabulous book, and I highly, highly recommend it. And there's a workbook that goes along with it as well. And that book is for any type of depression, and even, I would say, any mood changes. It would be just very helpful. So a couple of things that you can do to help with the upward spiral is, to talk to a therapist, express yourself in writing, do little things that boost your self-esteem. Might be taking a shower, attending to your personal care, sticking to a routine and schedule, staying involved, staying socially active, allowing yourself to depend on others, sleep well, get plenty of sleep, enjoy the benefits of exercise, and then making the food and mood connection. When you eat well, you tend to feel a little bit better. If you don't eat well, you don't feel better usually. So the next slide we're going to go to talks a little bit about the benefits of exercise. And And I will just list these out. Exercise is so much more for your brain. It does a lot for your body, but it does a lot for your brain too. So you see the serotonin increases. You can see that that often will help improve with thinking. It calms your stress hormones, and you tend to sleep better when you exercise. Now, this might not be the case with everybody in terms of that they sleep better when they exercise, and definitely make sure you're exercising at the right time. You don't want to do cardio right before you go to bed, because then you're going to be wide awake. But exercising gives you a lot of benefits to your brain and to your mood, and I want to reiterate that again. Julie on here says she looks forward to her Thursdays because it's her MS group. That is really great. So we're going to move on to the next slide, which is talking with coping with apathy, loss, and motivation. And apathy is that loss of desire of wanting to do something that it's that you might know that it would be good to do something, but you're just not feeling it. You don't want to do it. And it's really hard to push through with apathy. And often people that have mood changes, and definitely with seasonal affective disorder, can have feelings of apathy and loss of motivation. And while there's not a medication that can directly help with apathy, the one thing that can, and I believe it was Rhonda, if I'm remembering correctly, that mentioned this, is schedule and routine. So if you're dealing with apathy, if you're dealing with a loss of motivation, kind of just having a hard time plugging through, I want you to consider having a routine and schedule, because when you have a routine and schedule, that kind of dictates what you do, and you don't have to think about, should I do this at this time, because your routine says that you do it at that time, and that tends to help people probably the best with apathy. And I've done a lot of work with different patient populations, and and what I know with apathy, one of the best things to have is a routine and schedule. So we're going to move on to the next slide real quick, and we're going to talk a little bit about biofeedback. So biofeedback is what you can do, things that you can do that create a feedback cycle where you feel better. So think about a time, so it's technically like a technique that you learn to kind of change the physical response in your to stress, or physical response in your body. So if you think about when you listen to music, you automatically feel better most of the time, unless it's like a sad feeling or emotion. But when you smile, you tend to feel better. And I notice when I unclench that I tend to feel less stressed, because when I'm super stressed, I clench. Changing your breathing. This can automatically calm your body. And we've talked about different breathing types. My favorite breathing is the 2 to 1 breathing, or the 1 to 2 breathing, sorry. It's where your exhale is twice as long as your inhale. So if you inhaled for a count of 3, you exhale for a count of 6. That's going to calm the vagus nerve down over a couple of series of breaths, and that can help relax your body. And then relaxing your muscles, and that's kind of the same with that tenseness. If you're holding your shoulders high and tight. So biofeedback is one of the things that we can do. So we're going to move on to our next slide real quick. So we have a couple takeaways, and we're not quite done yet, but I want you to know that seasonal depression and regular depression are both very treatable, and there's help available. So more than anything, I don't want you to go through long periods of time of having sadness or feeling heavy or loss of interest. I want you to make sure you talk with your doctor about it if you are experiencing extended challenges with your mood. That there's things that you can do to spiral up, and you can do these things on a bad day, or you can do them if you're having seasonal depression. You can also do them if you're having regular depression, or just if you're having MS. Just have MS and you want to do these little things to help set you in the right space, and making your bed is a really good example. The other takeaway is that you're not alone. And MS, I really do believe it shouldn't be done alone. It's important to build an emotional support team. I'm so thankful for all of you that participate here on the MS Mental Wellness Chat, because what you do is, I know that we have some that listen only, and that is okay. I'm okay if you listen only. We want everyone on here that needs to be on here. But for the ones that are participating, you're one, getting to share your voice, but then you're also connecting with each other because everyone is paying attention to what I'm reading, and that really connects you guys too. So we're going to go to the next question. I'm hoping this is a chat box question. Perfect. I wanted to take just a couple minutes and ask you. I have, for 2023, I have some ideas for mental wellness chat, and I have some, but I wanted to ask you, because sometimes I don't get to see quite the survey. What do you want to chat about in terms of mental wellness, mental health, etc.? Is there anything that you've been wanting to learn about or that you've been wanting to talk about with in this group where you wish you would see anything that you want to really kind of dive into? I'm going to encourage you that you can definitely put it on here, and then also you can put it on the survey, and I can ask for it and tell them that I really asked for you guys to be intentional with letting me know topics. Nancy said dealing with acceptance. Thank you, Nancy. That would be really great. I'm actually working in my current role. We're working on navigating a new normal for the patient group that I'm working with, and that has a lot to with acceptance, pain and depression. Is there any therapy regarding cognitive impairment for those with MS? Okay. All right, that's good. I want you guys to continue to think about this because this chat is your chat in your place. And then Patty said, this is a great, when to be resigned and when to fight for things. So I kind of would word that like when to hold on and when to let go, kind of. You guys have been really great with those suggestions, and keep them coming in your surveys as well. And so again, I'm going to thank Bristol Myers Squibb for their support of tonight's MS Mental Wellness Chat. Without them, this program would not be here, as well as MS Views and News, because they are the reason that we are here and this program is. So I usually end all of my mental wellness chats in this way. It's not goodbye. It's I'll see you later. I wish you all a very good month. And if you are experiencing any mood changes or just curious about it, don't be afraid to talk with your doctor about it, and don't be afraid to do things that spiral you up, because that just takes, start your day good, end your day well for yourself, have things to look forward to. Those are things that are healthy for all of us to do. And so I'm going to say goodbye. Not really. I'm going to say see you later. And I hope to see you next month in the Mental Wellness Chat. And I wish you guys all a beautiful month. All right. Bye.